What is a blood transfusion? A blood transfusion is the intravenous administration of blood or blood products which have been donated by another person. A person who donates blood is called a blood donor. Blood transfusions increase blood volume after large amounts of blood loss. This may happen during some types of surgery or after a traumatic injury. What does whole blood contain? Whole blood contains all the components of blood, including red and white blood cells, platelets, and plasma. It is transfused if several blood components need to be replaced at the same time. An example of patients who might need a blood transfusion are patients with severe anemia. They may require a blood transfusion to increase the number of red blood cells in their blood and increase their hemoglobin levels. What is packed cell volume? Packed cell volume is the volume of red blood cells in the blood. It is also called the hematocrit. Normal packed cell levels vary between men and women. The normal range for men is 41 to 51%, and for women, it's 36 to 44%. What is hemoglobin? Hemoglobin is a type of protein found in red blood cells. It transports oxygen around the body. Hemoglobin is measured in grams per deciliter of blood. The amount of oxygen that's delivered to your body's tissues depends on a number of factors, for example how well the red blood cells work. Women usually have a slightly lower hemoglobin level than men, and older people of both sexes tend to have a lower hemoglobin level. What is fresh frozen plasma? Fresh frozen plasma is the liquid part of blood that has been separated from other blood cells. It is frozen less than 8 hours after separation and consists of the proteins, carbohydrates, fats, and vitamins which are normally present in blood. Fresh frozen plasma should be administered as rapidly as tolerated because coagulation factors become unstable after thawing. Fresh frozen plasma is used to treat disorders associated with low protein content in the blood, or where there are insufficient blood clotting factors present in blood. An example of diseases that causes protein deficiency are severe malnutrition diseases, for example, marasmus or kwashiorkor. What is cryoprecipitate? Cryoprecipitate or cryo is a part of plasma. Cryo contains clotting factors which reduce blood loss by slowing or stopping bleeding. The blood clotting proteins found in cryo include fibrinogen, factor VIII, and factor XIII. Platelets are commonly transfused to patients with low platelet counts. This is known as thrombocytopenia. Patients with low platelet levels are at risk of excessive bleeding when injured, and may even bleed spontaneously, for example during a severe nosebleed. What is an exchange blood transfusion? An exchange transfusion is performed by slowly removing a patient's blood and replacing it with donor blood or blood products. This is a life-saving procedure which may be performed in cases such as sickle cell disease. The donor blood is taken from a person who does not have sickle cell disease.